BAHNG stands for the Black and African American Healthcare Network Group, and the goal of the group is
to educate our employees and community on healthcare disparities among all people with a target focus on African Americans.
You can reach our group by contacting us at
BAHNG@conehealth.com, BAHNG@conehealth.com.
If you have a burning desire to get out and volunteer in your community, please do not hesitate to reach out to us. We look forward to hearing from you soon.
My name is Jasmine Haney, and I'm the chair of the Launch Inclusion Network. Launch is a great way to build your network, be in the know, shape your community, make an impact, grow and develop, and find your voice. To join Launch, use the form on our SharePoint site or email us at launch@conehealth.com. We look forward to having you join us.
Hi, I'm Melanie Hensley. I'm the nurse with the palliative medicine team for the Cone Health System, and my pronouns are she, her. I'm a member of the LGBTQIA+ Inclusion Network. Our aim is to make sure that the voices of our LGBTQ+ friends, colleagues, and community members are heard and respected. Unfortunately, there are still gaps in healthcare for people in the LGBTQ+ community due to fear of and very real discrimination, and we're working to end those. We're always happy to have new members on our team. You don't have to be part of the LGBTQIA+ community to join us in the Cone Promise to be here with you, no matter your gender, orientation, or sexuality. To become a part of the LGBTQIA+ Inclusion Network, email us at lgbt@conehealth.com.
Greetings, Cone Health, and thank you for your interest in diversity, equity, inclusion, and veterans. I am Dave Jenkins, Operations Director for West Long and sponsor for VetNet, a Cone Health inclusion network for those who have served or are champions for veterans. Our team of nearly 100 Cone employees spans all military branches, each Cone Health division, multiple healthcare disciplines, and reflects the diversity of our workforce. We seek to support each other through recognition, social activities, and community engagement. Cone Health recognizes the sacrifices of those who have answered the nation's calling. We value the skills and experiences veterans bring to our organization. To be involved, simply email us, veterans@conehealth.com, and tell us a little bit about yourself. Thank you all for your support.
I am Nigel Ricks, and I am the advisor for our Cone Health Women Inspiring Women Inclusion Network. Join us today and be inspired.
Hello, good morning to you all. I am so thrilled to be able to spend some time today to highlight our network groups and our inclusion network groups. So Cone Health has been on this journey for a very long time, and we are fortunate enough to have 5 inclusion network groups. And today we're going to talk to 2 of them. And we really want to just dig a little bit deeper into the purpose of the network group, why you're even involved in a network group, and just kind of chat a little bit about the experience that you've had and the impact that you all have brought. So we have 2 network groups that are here with me today, and that is BAHNG and Launch. And so first off, let's start by introducing yourself and just tell us who you are, where you work, and how you are associated with your inclusion network group. And so I'm going to start with Casman.
Hi, my name is Casman Mitchell. I am the pre-boarding navigator for talent acquisition, and I am the chair for BAHNG.
My name is Tiffany Pearson. I am the Assistant Director for the CHMG Patient Engagement Center, and I am one of the co-chairs for BAHNG.
Hi, everyone. My name is Jasmine Haney, and I am the Assistant Director for Operational Effectiveness and the chair for Launch.
Hello, everyone. My name is Tanisha Barnes. I am a system-wide IT project manager, and I am the co-chair for Launch.
Thank you. Thank you all for being here. So, we love to throw out acronyms at CONE, right? And so I said it, you all said it, we said BANG, we said launch. So, what is BANG, right? What does that stand for? So tell us a little bit about BANG and how that came to be BANG.
So BANG stands for Black and African American Health Network Group. And what it does is basically we get out into the community as well as in-house with our employees, and we target the underserved populations.
Okay. All right. So what is launch, Jasmine?
So, Launch is a inclusion network group that really aims to connect, engage, and empower all future and aspiring professionals and leaders across the Cone Health enterprise so that they can reach their full potential and really help the organization drive toward its bold new future. And Tanisha and I co-founded Launch a few years ago now. It's been almost 3 years. And so we addressed a need. We found that there was a need. We reached out to a lot of folks and they said, yeah, we need a group for this. And so Launch was founded, and launch really just refers to the term launch your career.
So we're gonna dig a little bit into BANG now and just learn a little bit about that. So in 2012, a group of you all said, hey, this is a need for the organization. Why is that a need? And what need was BANG serving? Like why BANG?
So there was a lot of information that the community did not know about, far as high blood pressure, high cholesterols. So Cone Health decided that BANG, was a need for the community to spread the word, provide free health screenings for the community, and also for our organization. So we were able to provide that for the community, our organization. We also do that for local universities within the community and high schools as well.
Oh, wow. So BANG really was created as a way to reach out to the community, to the Black and African American population, right?
Correct.
And so, yep. So when you talk about diabetes screenings and blood pressure, we all know that those really are two of the diseases that really are prevalent in the Black community. And so I'm glad that you all decided to do that because it's all about awareness, right? And it's all about helping people to be healthier. And so that's good. So you all go out and step out and do that in the community. And so I am sure that there has been a lot of growing pains and lessons learned and all of that. So tell me at least, Tiffany, about one lesson that you've learned about this, the network group and how it's grown and just what things that you've learned in this process. Because you've been in there since 2012, Tiffany?
No, I've probably been in since 2015 or 16.
Okay.
But a lesson that I have learned is that we really have to meet our community where they're at. And BANG has allowed us to go out and educate these people in gyms or churches where they actually feel comfortable. We know that a lot of the indigent or underserved populations don't really trust the healthcare system. And so being affiliated with BANG really allows us to get out there and meet them where they're at and kind of supply their need.
Awesome. That brings us back to COVID, which we're still in a pandemic. Some people don't think we are, but we're still in a pandemic. And I know that BANG and you all stepped up during that time in COVID and making sure that we were getting to the people of color and the Black and brown communities to make sure that they were getting tested. And then now, with the vaccine. So that's awesome. All right, so launch. So this is one of the misconceptions of a network group is that you have to identify with that group in order to be a part of that group. And we all know that that is not the case. So the inclusion networks are really around awareness, around meeting the needs of the community as it relates to health. And it's also a learning zone, right? It's an area where if I'm not familiar or I want to learn more about that particular group, then I could join that group and start my learning, right? And so I think that we want to clear that up because I know that that's a misconception. Because, you know, when you hear about young professionals, people automatically say, well, am I young enough to be in there? Or, you know, what can I do? So talk to me a little bit about launch and how you all saw the need, right? And said that this is an opportunity. And just tell us about a little bit of some of the things that Launch has done since they got started. And Tanisha, I'll start with you.
Okay. So one area of launch is indeed we are open for anyone and everyone who is interested in doing something different in their career. It may be staying within their same department, but maybe looking at how can I go to the next level as far as maybe a lateral move. Maybe it's just networking because some people have joined our group and said, "Oh, I didn't even know Cone had this, department, whatever that department may be." And just networking, getting to know different people, learning different things that we put out there regarding our programming. But Launch has really widened our network, has helped new people navigate, how to maneuver and become resourceful. Maybe it's someone in an area where payroll, someone's come over and they're asking questions during our event and they're like, "Oh, I had no idea. I didn't even know where to start to even look for some of this information." So Launch has definitely been that go-to for different individuals. Some some organizations say that they have what they call seasonal professionals as well as young professionals, but we like to be open and inclusive for everyone because everyone can truly get something out of it. We've had some individuals who've shared with us, I didn't necessarily get anything out of it because I'm pretty much in my road to retirement, but I learned so much that I've been able to share with my children or my grandchildren, whatever the case may be, that they've been able to just use some of the fundamental skills that we provided throughout our programming in order to enhance their child or even maybe a employee of theirs to grow further.
That's good. So, Kevin, I have to ask you because I know we talked about the misconception, right, around who can join what groups. So, the members that you have right now, are they all African American?
They are not. So Bang is
Good.
pretty diverse, and it's getting
Okay.
there. Of course, we have a couple of different diversity, but it's definitely getting there. So definitely feel free to join, no matter what color you are, male or female. We accept you. We are family, so we welcome you with open arms.
That's lovely because I think that, trying to shift that so that people understand what the networks are and how they are made to be inclusive, right?
Exactly.
And so that's the purpose of them. And so, so Jasmine, you all have a very diverse group, I'm sure. Have you had anyone that maybe wouldn't consider themselves a new professional or young professional to join the group?
Absolutely. As we shared earlier, as Tanisha mentioned, launch is open to anyone in the organization as the other network groups. And so, whether or not you're an employee who, is looking for a change in career or you're just looking for development opportunities, or if you're a leader, we have a lot of leaders who, they may not consider themselves a young professional, whatever that means, right?
Right.
But they have team members who they want to support, or they just want a better understanding of what generational diversity actually means and really how to leverage that instead of looking at that as a negative. And so hopefully we're able to help dispel some of those myths and misperceptions that folks have about people in those categories. But we definitely have a wide variety of folks who are within our group. And so we welcome everybody.
Awesome. That's good. And I think that the more we get that word out, right, and the more we're able to talk about that, then the more people will feel welcome, right, and know that there's a place for everybody. So that's awesome. So as we think about you all both of your all of the groups have strategic plans, right? And so I just want to dig a little bit deeper into that, Jasmine, just to say, okay, so tell me one of the areas that you're most excited about and that you think will be most impactful for Cone Health. one of your strategic goals?
I'm trying to think, there's so many. So I think that probably maybe the most impactful. So again, going back to the connection, engagement, empowerment, probably empowerment is the most impactful. So, yes, we can provide, mock interview opportunities, and yes, we can connect people. But if we don't have the formal structures and support systems within our organization to support that, it's not going to help, right? So when we started launch back in 2018, and Tanisha and I were going out and talking to people, getting feedback, a lot of people felt like, I don't know how to navigate the system. I don't know, what my career trajectory looks like. There's no formal career ladder. I don't know how to find a mentor, things like that. And so, one of our goals is really to help the organization put some of those formal structures in place and really connect the dots for people. And so that's something that I'm most excited about.
Absolutely. Absolutely. That's what it's all about, right? It's that for us to feel that we have an inclusive organization where everyone feels that sense of belonging. And we got a lot of work to do to get there, right? But you all are definitely on the path to helping Cone Health do that. So Tiffany, what about you all? So as you look at your strategic plan, just tell me one thing around what you're excited about and that you think will be most impactful.
So I think for BAHNG, we know that our brand promise with Cone is to be right here with you. And BAHNG, getting out in the communities, allows us to be right there with our community and our patients and our underserved populations. So I'm excited about that, bringing healthcare out to the communities, to your event centers, your churches, things like that, just to build that relationship. In order for these groups of people to feel good about coming to us, we have to establish that trust. And if we can meet them out in the community while they're still, quote unquote, well, and establish that trust, it will help them if they do have to come into one of our offices or our hospital facilities. So that's the exciting part about me, just building that relationship with our community.
Yep. Relationship is everything, and trust is the foundation to that. And so just hearing you say that is really aligned with who we are. So now I want to get a little bit deeper into things that have happened over the last year or so, right? Our world is changing. It's changing dramatically. And at Cone Health, we want to be ready for that, right? And so Jasmine and Tanisha, when y'all talked about the programming, right? And you talked about generations in the workplace and how that works, that's going to be extremely important as we build Cone Health for the future. So when you think about where we are today, and with all of the different movements that's happening, and just people feeling more comfortable speaking up and letting their voice be heard, tell me how you all approached this or thought about this over the last year. So with the Black Lives Matter, with just the hatred toward the Asians, and just a lot of different things that we had to encounter, and then COVID itself. Like how was last year for the network groups? The last year has been really, really challenging, and so I just want to hear a little bit about some of the struggles or some of the things that made you think differently or look at things differently based on what was happening in the world.
So I could definitely say that there were a lot of, with the challenges of, as we considered having two pandemics, one pandemic being COVID and one pandemic being racial disparities and everything that's going along with that. One thing that that Launch has tried to do is to bring everyone together to understand each other a little bit better. So it may be we're having just a random trivia night. And during that trivia night, we may have information to celebrate, the Black and African American community, as well as having a different group to celebrate the Asian community or just women in general. So we try to find different ways to educate individuals as well as have fun with the education in which they were receiving, so that they were able to really bridge some things together and become okay with being okay. It is okay to be okay, but also to remember that there are folks who are hurting. There are folks that are going through some different things, and trying to be there for them in a way that maybe it just takes you to understand and have a conversation.
Yeah, that's really good. And I love the fact that, we have 5 network groups and you have a different focus, but you come together, right? And I think that that's the beauty of it, is being able to come together and support one another in whatever it is that's going on. So I think that's a key point that we don't want to miss that, because hey, listen, when we can all come together, collective ownership, that's when things start to move. And that's when you start to see the needle moving a bit.
Right.
So, Casman, what about you all? Tell me a little bit about the last year and kind of how you all approach this.
So it was definitely challenging. I can say that for sure. But something that my team and I just felt comfortable doing was just talking it out honestly. Just giving, opening that door for them to just be open and honest, express how they feel. Because they felt like, they didn't really have anyone to talk to within the organization about these things. So we just made sure it was comfortable. Of course, it was private, but they were open and honest and expressed their concerns about everything that was going on, dealing with Black Lives Matter, COVID, the vaccine. We did a survey within our team just to get their input on how they felt about it. So just creating that space of environment that they're comfortable to talk to us about anything and express their concerns.
Awesome. That's great. So, as you all said at the beginning when you introduced yourself, you all have full-time jobs, right? And so I just want to talk a little bit about balance and about how you all are managing to have a full-time job and still be able to be chairs and co-chairs of these network groups. What things are you doing to find balance in that?
I think just communicating with the leadership team, it's about 4 of us, I think.
Yeah.
And, we'll say, hey, we can't make this. Can you do it? Can somebody cover the team meeting? Things like that, just to make sure that we can allow time for ourselves, or we can show up to what's important pertaining to our jobs. And then with my direct leader, just communicating with her, hey, I have this going on with BAHNG, and my presence is needed. I'm available via text message or things like that, just keeping that open so that I can attend everywhere that I feel like I need to, and being honest with myself, like, hey, I've had enough, so I'm going to, miss this engagement. As it goes back to participation, recently on our team meeting, I really encouraged our team that doesn't actually participate, out in the community, to, hey, show up and give those that show up every event a break so that we can, do some self-care. So just encouraging that as well, and just communicating like, hey, I need to have a break before I have a break, and being honest about how I'm feeling, or if I'm overwhelmed, or if I can't take on one more thing. So that's how I take it.
That's awesome. I love what you said. Have a break before I say that again.
Have a break before I have a break. Like,
Oh yeah, I love that. I love that. I'm gonna have to write that one down because I need to apply that sometime.
right.
At times, we may have to reschedule a program or reschedule an event. So maybe we were scheduling something, within 60 days. However, just the bandwidth of everyone, especially with COVID and changes that individuals had to do within their own departments, we just didn't have the bandwidth. So maybe it moved from 60 days to now 90 days out. We will have, said event. So sometimes rescheduling what we're wanting to provide to our organization will be what we end up doing, but definitely it is a full-time job within itself to keep it
Oh,
running.
yeah. As you think about the dive-in groups, and I read this somewhere, and I didn't fact check it, so I'm just gonna say it, but I don't know. But that the first employee network group was formed in like 1970. Have you all heard that before? Yeah, and I'm gonna research it a little bit, but I did, and I was thinking, wow, you all weren't even born, okay? I was like 1 year old or something. So when you think about that, and you think about the fact that this has been something that we know has been needed since 1970, right? And there are times that we feel like, dang, we're still talking about and doing the same things from decades ago. And sometimes that can get you, you can get a little discouraged by that. And so I want to ask you all, 3 years from now, what would you hope that the network groups, or what value will you want to see that the network groups have provided for cone health in our communities?
So for me, as it relates to BAHNG, as we move forward, I would like to see Cone say, yes, there are lots of populations of patients that we can't reach. And think about going out to some of the other counties that we service. I know we have like community health and wellness in Greensboro that sees the uninsured or underserved population. But when I think about, your Rockingham counties and going towards Winston, places like that, it's like we don't really have a clinic for those patients. And so if we're going to continue to meet our patients where they are, just being able to have primary care in some of these rural areas so that our patients can get access.
Thank you. Beautiful. Who else? What else would you like to see? Tanisha?
I would like to see our vision of making Cone the place for folks to really launch and grow their career and towards, Cone's bold new future, that actually be really realized, where folks are able to join in, they're able to find that connection, and whatever that need is for them, they're able to get that out and share with others and really grow and harvest their career, because folks have real trouble, navigating the system. And there are some leaders who are very supportive, and then there are some that may not know themselves, and so they're not able to support folks the way that they need to be supported. So, in my terms, I would like to see our vision of folks really launching their career and making Cone a great place in order to do so really be materialized.
Absolutely. What is one thing that you do every day to make sure others feel a sense of belonging?
One thing that I do is something very simple: speak to people.
Okay.
Nothing goes further than a group, good morning and a smile. You don't have to have a full conversation, but you never know what people go through. So just a nice, greeting and a smile.
All right. All right. So another question. So what is one thing you do to re-energize yourself when life and work makes you feel a little bit less empowered?
So I'm not sure about everyone else, but for me, working remotely, I had a time with just working nonstop. So something that I do is I'll take a break and I'll go outside. I'll take a walk, take a jog to clear my mind. That definitely helps me out.
When I've lost my mojo, it helps me just talking to coworkers or close friends just to help remind me of my value and my purpose.
Listen, well-being is where it's at. And guess what? If we don't recognize and do it for ourselves, we cannot expect anybody to do it for us. We have to do that for ourselves. And so, with you all having jobs, of course, and being chairs and on the leadership team for these inclusion groups, it's really important that you all really do that and model that for the organization. So thank you all for that. As we know that this month of August, we're going to be highlighting all of the network groups. And you all have done, videos and have your strategic plans, and we're going to be highlighting all of the network groups. As you think about that, and if someone were interested, but a little bit nervous about joining a network group, what's one piece of advice that you would give them?
One piece of advice I would give is for them to attend one of our events and to feel free to ask questions.
Step out your comfort zone and feel free to contact the leadership team. We're here for you, so we're here to answer any questions or concerns that you have. But just step out. We're here for you.
So I'm so excited about August and how we'll highlight you all and all of the great work that you all are doing. Of course, I couldn't have all 5 networks here, so I chose the the one that has been here the longest and the newest one. So I really appreciate you all taking the time out of your schedule to be a part of Authentic Moments with Kiva. Really appreciate you all, and thank you for your time.
Thank
Thank
you.
you.